ALARA is a safety principle designed to minimize radiation doses and releases of radioactive materials. More than merely best practice, ALARA is predicated on legal dose limits for regulatory compliance and is a requirement for all radiation safety programs. ALARA stands for as low as reasonably achievable and is based on the idea that any amount of radiation exposure, big or small, can increase negative health effects, such as cancer, for an individual. It is also based on the principle that the probability of occurrence of negative effects of exposure increases with cumulative lifetime dose. As such, the ALARA principle is considered a regulatory requirement for all radiation programs licensed with the Nuclear Regulatory Commission and any activity that involves the use of radiation or radioactive materials. Another way to think about the principle of ALARA is that all radiation exposure should be avoided if it has no direct benefit. In veterinary medicine, the ALARA principle guides practitioners to use the lowest possible dose of radiation necessary to obtain diagnostic images without compromising the quality of care for the animal. This involves optimizing imaging techniques, such as adjusting exposure settings and utilizing appropriate shielding and protective measures. By adhering to the ALARA principle, veterinary professionals can reduce the risks associated with radiation exposure for both themselves and their animal patients. There are 3 factors to the ALARA philosophy which, when executed correctly, can reduce and even prevent unnecessary exposure: time, distance, and shielding. Time. Limit the amount of time spent near a radiation source. If you must work near a radioactive source, you should work as quickly as possible and then leave the area to avoid spending more time around the source than necessary. In veterinary medicine, this may be achieved through sedating patients to allow for faster imaging or ensuring alternating schedules so no one employee is continually receiving radiation exposure. Distance. Increase the distance between yourself and a radiation dose. The farther away you are, the lower the dose you will receive. In many cases, the dose rate decreases as the inverse square of the distance. When the distance is doubled, the dose rate goes down by a factor of 4. In veterinary medicine, this may be achieved by utilizing positioning devices or sandbags so a tech does not need to be in the room during the X-ray, or again through patient sedation. Shielding. Put a barrier between you and the radiation source. The type of barrier will depend on what kind of radiation source is being emitted, but should be made of a material that absorbs radiation such as lead, concrete, or water. This can also include PPE such as thyroid shields and lead vests. In veterinary medicine, this may be achieved by wearing all required PPE every time you help take an X-ray, or ensuring you are standing behind a protective wall during the imaging. Making conscious efforts to spending less time in the X-ray room with less repeats and lower settings, increasing the operator distance from the X-ray source, and using radiation shielding, such as a lead-lined apron, thyroid shield, and lead-lined gloves, will reduce radiation exposure. By incorporating these protective measures into their daily practices, veterinary hospitals can effectively adhere to the ALARA principle, ensuring the safety of both their staff and the animals under their care, while still achieving accurate diagnostic results.